Well, if wearing a mask is causing you the worst breakout since puberty, you're not alone. Here to talk about maskne and about the new season of her wildly popular show, Dr. Pimple Popper, it's Dr. Sandra Lee. Hi, Doc.
Hi.
Hi, Dr. Lee. It's so good to have you.
Oh, I'm really excited to be here. I haven't met you guys before, so this is absolutely lovely.
Oh, well, listen, we know who you are. And we're going to talk about mask acne in just a bit. But first, we have to talk about your show, Dr. Pimple Popper, which I will tell you is on in my house because my kids love it. I have a hard time watching it, so I can't. But then they come after your show and then they want to come look at my back to check me out. So I want to thank you for that.
I don't know if that's a thank you in jest, tongue in cheek or not, but yes, I understand. It has been such a wonderful ride. I mean, to have this show that, it is like something that kind of gets people a little bit uncomfortable, especially especially probably if you see little clips.
Hey, yeah,
As we're watching, it is actually ultimately a feel-good show. It is so about, it really makes us feel good about humanity, especially during this crazy time that we're going through right now.
Yeah, Doctor, why do so many people like watching these shows? They're very fascinated by them because, I get a little squeamish.
Interestingly, it makes people feel more relaxed or makes people feel like happier about, just because I think that you're taking something that is not supposed to be there and sort of putting it back in its proper place. And that we're really helping these people. We all understand what it's like to be embarrassed about something, maybe a big pimple on our face or just something about us, the clothes we're wearing or whatnot. And we all get that. And to see this change in people and have them able to, join the human race like the rest of us, it really makes me feel good. So it's like a relief sensation in a way for a lot of people. And it just makes you just feel like you're in a good place.
Yeah. What's coming up on the new season?
Again, like you can see some of the pops. We've seen a lot of them during the pandemic taping there, where I at least got to do something and move forward, where I got to meet some of these people via internet, kind of like how we're doing this right now. But we've really been able to see some of them and get a lot of these cases treated. And it's the same, same kind of thing. We keep outdoing ourselves. That's the crazy thing. There's always a bigger case, which is stressful, but also so amazing that I get to be a part of it.
All right, Doctor, be honest. Have you ever been grossed out?
Yes, certainly. I've been maybe not so grossed out, but more taken aback by things. I think it sort of trained my brain and trained my staff too. It's so important to make sure people are comfortable, make sure they feel like they're not embarrassed to come see us. So it is so you really don't ever remark or say anything or try to make a face if something is gross to you. You really try to keep that poker face. So that's really important.
Right. How did the show get started? Is it that a former patient pitched you to TLC?
No, actually, I've been on social media. I grew my social media account, Dr. Pimple Popper, for 5 years, and then I had production companies kind of come pursuing me, and I was really kind of it was really kind of scary to me because I didn't really look for this, though. It was such a welcome, like such an amazing thing. I mean, I'm so lucky. I'm so lucky to have the opportunity to do this, but it wasn't really something that I was necessarily looking for. And I was really scared about letting somebody else tell my story, you know what I mean? As opposed to me my own videos. But it has been so beyond, like TLC and Discovery. It's just been such an amazing ability to reach people now around the world. That's just mind-blowing to me.
Yeah, people can't get enough of it. I mean, 3 seasons in now. Now we're all dealing with the masks and what's now being called maskne. How do you avoid the breakouts? Because typically I don't ever get zits on my face, but even with the mask, I've noticed, sometimes I'm like, ew, what's going on here?
I mean, isn't it like, I hate to give you this description and put it into your head, but it's sort of like you're hanging out inside your mouth sometimes. Do you know what I mean? Under the mask, it's humid. And then if you have a lot of makeup on or just your oily skin, it all kind of just grows in there, you feel like, and you can feel your pores getting clogged up. So two things mainly happen. One is you can get like a rash from irritation from your mask, and the other is acne, whether it be just because there's a lot of clogged pores there more so, or your mask is actually rubbing on your face. So one huge tip that I think is key is to try to get a salicylic acid body spray. Actually, salicylic acid is a chemical peel acid that will help to settle down into your pores. It's small enough to get into your pores and sort of clean them out. So if you get something like that, like I have a spray here, and you just want to really spray the inside of your mask, like just actually put it on the inside of your mask, let it dry, and then put your mask on. And you can do that between mask changes, and you feel better about it too, because you don't have time to wash your face and you have makeup on and you don't want to mess that up. So if you do that, it kind of helps you feel like it helps to freshen up your mask, and it's going to do something. It's going to help to prevent acne or help prevent your pores from getting clogged up.
Is that something that we can just buy over the counter?
Yeah,
We
yeah.
don't have to go. Okay.
Yes,
awesome.
this is my skincare line, my SLMD skincare line, but you can get it. There are other brands too, but it's very easy and simple to do, and this is so easy to carry around too. I'll send you one.
Exactly.
Especially for your daughter. Because I know.
Okay, well, let me ask you this. What's the best type of mask to wear to avoid acne?
Oh, well, that's tough, because I think that we as healthcare professionals, we have to wear more, protective masks. So like we wear N95s at work, we wear that all the time. And the more protective, the more you're going to protect yourself. But the more opaque they are, the more difficult they are to, breathe and feel like your skin is being allowed to breathe. I think most people want to wear cotton masks if you're just doing, daily kind of things, because at least cotton is going to wick moisture out. It's like why we wear cotton socks, because they're going to minimize sweating. You don't want to minimize moisture under here. So that's the best. But, it's just unavoidable. Sometimes you have to wear some of these bigger masks. If you do get, rubbing on your face, like I get zits on my chin, if anything, and it drives me crazy when I'm wearing my mask because I feel it rubbing, and that's going to aggravate it more. You want to get like pimple patches. You can get these even on Amazon. They're like these see-through, they have hydrocolloid in them. I always have trouble saying that word, hydrocolloid. And they you put them on, you warm your finger, with this pimple patch, you can barely see them, and then it helps prevent rubbing, and actually it helps to keep your hands off your acne too, so that you're not gonna, because that picking, I know I'm a popaholic, a professional picker, and I know that a lot of people that follow me tend to want to pick too, but you really want to keep your hands off these areas.
I was going to ask that. So you are supposed to leave them alone or leave it to the professionals?
Yeah, I mean, the risk is that I would never want to tell people to pick at anything, because that can lead to scars, that can lead to infection, and scars can be permanent. And you don't just know that anytime you kind of traumatize your skin, you're going to have issues there potentially. Scars or post-inflammatory hyperpigmentation, which is the darkening, or red spots and things like that. And just best to keep your hands away.
Dr. Lee, thank you so much for joining us today, and good luck on your upcoming season. Be sure to catch the latest season of Dr. Pimple Popper Monday at 8 p.m. on TLC.